Have you heard of drugs like Xanax or Valium before? These drugs are anti-anxiety medications, also known as benzodiazepines. Anti-anxiety medications are used to treat anxiety disorders. Obviously, they're used to treat disorders like generalized anxiety disorder or specific phobias and even panic attacks. Although they are pretty successful, there are a lot of side effects, and usually, with proper therapy, the same result can be achieved. Clozapine, Seroquel. Do these terms sound familiar to you? If they do, that's because these are pretty common antipsychotics. Antipsychotics are drugs that are used in a psychopharmaceutical approach to treating mental disorders. Antipsychotics treat schizophrenia, bipolar disorder, especially the manic phases, and even things like Tourette's syndrome. So they have a pretty wide range of use. There are two different types of antipsychotics. There are typical antipsychotics and atypical antipsychotics. And the only difference is that the typical antipsychotics were developed beforehand, whereas the atypical antipsychotics were developed more recently. But the most important thing is, how do these work? Antipsychotics work by blocking the dopamine receptors in the brain. Prescribed medicines
Some of
in
the
America are antidepressants, also known as SSRIs, or selective serotonin reuptake inhibitors. And that's exactly what they do. They inhibit the reuptake of serotonin, a chemical or neurotransmitter, in the brain. But it doesn't really help you if you know what antidepressants do without knowing exactly what they are. So antidepressants are drugs like Zoloft, Cymbalta, Prozac, Wellbutrin. You know all of these names. You've seen them on hundreds of commercials. Now, antidepressants do help some people, but one issue you really need to be aware of is when you see advertisements for antidepressants, you notice that they're very general. They advertise saying, "Do you feel sad? Are you upset sometimes? Are you feeling blue? You're depressed." And as a psychologist, you need to know that maybe someone's just having a bad week. Not everybody is depressed. So make sure you know who's depressed and who isn't before suggesting that they get on antidepressants.